All right, testing 1, 2, 3, 4, 5, 6. Chris and Matt, are you seeing the hearing room show up now with the audio going?
Still no hearing room.
Okay. So yeah, they're not getting it.
I need my remote.
Testing 1, 2, 3, 4. Testing 1, 2, 3, 4. Testing 1, 2, 3, 4, 5, 6.
Yep, so you're coming through loud and clear, Larry. Just still see the backdrop. Okay, we can
All right.
see the hearing room now.
Yep, testing 1, 2, 3, 4, 5, 6, 7, 8. Hearing room is coming through on program, testing 1, 2, 3, 4. And then is the camera switching, I guess. Who's ever in the booth needs to do the switching so we can see that that's working. Testing 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2.
Still not switching, see the main overall room.
Right. All right. Testing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 2, 1, 6, 7. Rayburn. Testing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Subcommittee will come to order. Thank you to our tech folks for getting us all connected. I ask unanimous consent that the chair be authorized to declare recess at any time during today's hearing. Without objection, so ordered. I also ask unanimous consent that members not on the subcommittee be permitted to sit with the subcommittee at today's hearing and ask questions. Without objection, so ordered. Since this is a hybrid meeting, I want to remind members of key regulations of the House Committee on Rules to ensure that the hearing goes smoothly. Members must be visible on screen for purposes of identification when joining the hearing. Members must also continue to use the video function of today's software platform, Cisco WebEx, for the remainder of the time they are attending this hearing, unless they're experiencing connectivity issues or some other technical problems. If a member is experiencing any kind of technical problems, please inform the committee staff as soon as possible so you can receive assistance. A chat function is available for members on the Cisco WebEx committee's the WebEx platform for this purpose, or you can call the committee's main phone line at 202-225-4472 for technical assistance by phone. Members may also not participate remotely in any other proceeding that may be occurring simultaneously. It's the responsibility of each member seeking recognition to unmute their microphone prior to speaking. To avoid any inadvertent background noise, like dogs barking or babies crying, I request that every member keep their microphone muted when not seeking recognition to speak. Should I hear any inadvertent background noise, I will respectfully request that the member please mute the microphone. Finally, despite this being a hybrid hearing, I want to emphasize that all the standard rules of decorum apply. As the chair of today's hearing, I will make a good faith effort to provide every member experiencing these connectivity issues an opportunity to fully participate in the proceedings. Members will have the standard 5 minutes to ask questions. To insert a document into the record, please have your staff email it to the committee's clerk, Mike Twincheck, at mike.twincheck@mail.house.gov. This hearing is also being live streamed for the public to view. Before we get started today, I want to recognize the loss of our friend and colleague, Congressman John Lewis. John Lewis dedicated his life to service to this nation and to the goal of a more perfect union. He famously said, when we see something that's not right, not fair, not just, you have to speak up. You have to say something, you have to do something. It's in that spirit that we hold today's hearing, which focuses on the experiences of vulnerable and underserved populations during disasters. Disaster survivors experience varying degrees of both impact and assistance as a result of factors such as race, ethnicity, gender identity or expression, immigration status, physical or mental ability, and socioeconomic status. As is often the case in this country, the most vulnerable among us are most adversely affected. during times of hardship. We are certainly seeing this play out in communities across the country with respect to the ongoing disaster recovery and the coronavirus pandemic. The continued failures by our emergency preparedness apparatus at every level of a government account for the well-being of certain communities prior to, during, and in the wake of disasters, and right now these are just unacceptable and must be addressed. Take several examples of the problem. Whether it's due to underfunded public transportation or insufficient means to pay for a personal vehicle, fuel, or alternate means of shelter, vulnerable populations in the path of disaster often lack the resources to evacuate. Second problem, while taking refuge and congregate sheltering during a storm, individuals with disabilities or mobility issues frequently face accessibility challenges due to a lack of proper accommodations. Third, some of our most vulnerable populations continue to be overlooked or neglected by existing Fema programs. For instance, in the wildfire-ravaged communities in California, people experiencing homelessness were told by Fema that they were not eligible for sheltering assistance to escape heat and smoke under the Stafford Act because their homelessness was a pre-existing condition. During this subcommittee's hearing back in March with the FEMA Administrator Gaynor, we raised some of these concerns. I noted then that FEMA's Office of Disability Integration and Coordination, which was established over a decade ago during the Post-Katrina Emergency Reform Act, we thought this would address some of the issues. But the current administration's attention to and engagement with people with disabilities is lackluster, to say the least. It is appropriate that we have this hearing today because just this past Sunday marked the 30th anniversary of the enactment of Americans with Disabilities Act. We have done a good job when it comes to improving conditions for those with disabilities. I'm proud of the U.S. when I travel internationally. Much has been accomplished, but much needs to be accomplished. And it's troubling when we consider how far we need to go to live up to the intent of this landmark legislation. I'd like to conclude by saying that the spectrum of vulnerable communities represented by our witnesses today is by no means exhaustive, but we hope that they can provide some perspective so that we might take a step towards making disaster response efforts and assistance more inclusive, more just, more fair, and more right. With that, I thank you, and I would yield to the Minority Leader.
Thank you, Madam Chair, and thank you today for the witnesses that are joining us remotely. Before I start my comments, I wanted to just take a brief second to honor the life and the legacy of John Lewis. John and I became friendly at my first State of the Union address, where I showed up 10 minutes beforehand thinking I was going to have a seat. And remarkably, the seat right next to him was open, so I sat down and we started talking and became friends. And one time a reverend came down from Syracuse. I said, John, would you just say hello to him? He idolizes you. And John said, yeah, sure, of course. He then said, come on back to my office, brought us back to his office, canceled his appointments, and spent an hour and a half with the reverend, just showing him everything in his office and talking about the history and what he's been through in his life. And he couldn't have been more gracious and humble, and he impacted that individual's, that pastor's life immensely, and it's just a small example of the kind of person he was and the gentle spirit he was and the great leader he was. So I commend him to the afterlife here, I guess, but I also commend him for a life well lived and an example that we could all follow. And I miss him already. I'd like to begin by bringing specific attention to important work that is being done in my district to support vulnerable populations amid the COVID-19 pandemic. Organizations like Vera House, Access CNY, the Food Bank of Central New York, and so many others are working hard to maintain services in our community during this disaster. These organizations provide critical services to vulnerable members of our community, including our seniors, survivors of domestic violence and sexual assault, individuals with disabilities, and families struggling with mental health issues. To provide a snapshot of the historic challenges these organizations face, the Food Bank of Central New York saw a 20% increase and households utilizing their services in the month of March alone. This translates to the distribution of 1.9 million pounds of food, 500,000 additional pounds compared to the food bank's typical monthly distribution. This increased demand persists and is indicative of the unprecedented nature of this crisis. Unfortunately, these conditions are being felt all across the United States. Americans are responding to the COVID-19 pandemic, as well as flooding, storms, and wildfires across the country. In many cases, these challenges are on top of ongoing recovery efforts from prior disasters. In all of this, it is critically important that all communities are prepared for and recover from disasters. To be successful, lawmakers must work to plan for and address the needs of the most vulnerable among us. These efforts are not only essential to saving lives, but to helping impacted areas put the pieces back together quickly. To this end, Congress has enacted significant reform over the years, including the Post-Katrina Act, the Sandy Recovery Improvement Act, and more recently, the Disaster Recovery Reform Act. Each of these bills and others included provisions intended to help the most vulnerable. In DRRA, for example, we ensured those with disabilities could be eligible for additional assistance to ensure that repaired homes are accessible. We expanded FEMA's flexibility for temporary housing solutions, and we clarified eligibility for food banks. We also worked to update and improve the nation's public alerting system, IPAWS, to ensure capabilities are in place to reach persons with disabilities and those with limited English proficiency. And we continue to examine ways where FEMA's process can be simplified and streamlined to reduce administrative hurdles for eligible applicants. Ultimately, we must ensure our emergency management system works for everyone. Today, I look forward to hearing from our witnesses on what is working and where we still need improvement. I also want to welcome, for the first time, Mr. Garcia of California to our subcommittee, and I look forward to working with him on these and other issues. And that, Madam Chair, I yield back.
Thank you, Ranking Member Katko. I don't believe that our chairman of the full committee, Mr. DeFazio, is here, nor Mr. Sam Graves, who is the ranking member, so we'll go straight to our witnesses' testimony. I'd like to now welcome the witnesses on our panel. They represent great expertise, and we're looking forward to hearing from them. Mr. Curtis Brown, who is the State Coordinator of Emergency Management with the Virginia Department of Emergency Management. He's going to be testifying on behalf of the Institute for Diversity and Inclusion in Emergency Management. Mr. Chad Higdon, who's the CEO of Second Harvest Community Food Banks, and I know he's had an association with Three Square in Las Vegas. Ms. Marcy Roth, Executive Director and CEO of the World Institute on Disability, and Ms. Diane Yentl, President and CEO of the National Low Income Housing Coalition. We want to thank you for participating today. We look forward to your testimony. Without objection, our witnesses' full statements will be included in the record. Since your written testimony has been made a part of the record, the subcommittee requests that you limit your oral testimony to 5 minutes. So we'll proceed with the testimonies. Mr. Brown, we look forward to hearing from you first.
Thank you. Good morning, Chairwoman Titus, Ranking Member Katko, and members of the subcommittee. I appreciate the opportunity to discuss the disproportionate impacts on at-risk communities and solutions for addressing systemic and structural inequities in disaster management. My name is Curtis Brown, and I am an emergency manager and co-founder of the Institute for Diversity and Inclusion in Emergency Management. IDEAM was created to increase diversity in the profession and to promote the integration of equity for at-risk and marginalized people and communities into all aspects of emergency management practices. My approach to providing testimony and recommendations today is based on research data with a keen understanding that the equitable implementation of disaster policies would address the continuous losses currently left unaddressed after each disaster. Political leaders, policymakers, and emergency managers can no longer turn a blind eye to the recurring disproportionate impact of disasters on vulnerable populations. FEMA and the entire emergency management enterprise, federal, state, local, nonprofit, and private, must drastically improve. The COVID-19 disaster once again brings to light the glaring disparities that continue to entrap far too many communities of color in continuous cycles of tragedy and loss. COVID-19 is disproportionately affecting Black, Indigenous, Hispanic, Latino, and other people of color the most. What are the experiences of vulnerable populations during disasters? Unfortunately, the answer to that question is the same as it has been for quite some time, with examples of mass fatalities and economic loss throughout the 20th century and the first 20 years of this one. There are numerous documented examples of disaster inequities resulting in negative impacts for communities of color, underserved communities, and people with disabilities whose needs have not been consistently integrated into disaster preparedness, mitigation, response, and recovery efforts. Whether the disaster is a pandemic or an extreme weather event, one thing is consistently true. The most vulnerable individuals and communities will disproportionately suffer disaster impacts, fatalities, injuries, both physical and psychological, infrastructure damage and loss, and economic decline, which contributes to widening wealth inequality. Nationwide, Black people are dying at COVID-19 at 2.5 times the rate of white people. Considering flooding risks, research has found that higher share of the population living in the combined floodplain identify as Hispanic and Latino. People with disabilities fatality rate have been found to be 2 to 4 times higher than the general population. Unaddressed systemic and structural racism, inequitable discriminatory economic policies are the root causes for creating and enhancing vulnerability faced by at-risk and marginalized communities. Environmental injustices have located toxic facilities in and around communities of color, contributing to the concentration of Black and brown people with the same underlying health conditions that make COVID-19 so fatal. Integrating equity into emergency management and prioritizing the needs of the most vulnerable will produce numerous benefits, including limiting fatalities and injuries, reducing disaster costs, and improving the effectiveness and efficiency of emergency management operations. We have to commit to disaster equity and prioritize the needs of the most vulnerable in legislation, policies, practices, plans, and funding programs. We must commit to dismantling systemic and structural inequities in disaster preparedness, mitigation, response, and recovery to reverse the current trend of disproportionate impacts. Unfortunately, these numerous disaster events and lives lost have not prompted a major change in existing emergency management approaches. It has become painfully clear that the effective emergency management practices requires a new equitable approach that prioritizes those most in need. As we celebrate the life and significant contribution to civil rights of Congressman John Lewis, let his legacy serve as motivation to promote efforts to finally and fundamentally address the systemic and structural inequities that continue to negatively impact marginalized people and communities by integrating equity into emergency management. Thank you, Chairwoman Titus, and I look forward to offering recommendations and answering the questions from the committee.
Thank you so much, Mr. Brown. Mr. Higdon?
Good morning, Chairwoman Titus, Ranking Member Katko, and members of the subcommittee. My name is Chad Higdon, Chief Executive Officer for Second Harvest Community Food Bank, and I appreciate the opportunity to offer perspective regarding the experiences of vulnerable populations during disasters. I have been the CEO of Second Harvest for 7 years, which is headquartered in St. Joseph, Missouri, and serves 19 counties in Northeast Kansas and Northwest Missouri. Second Harvest is a member of Feeding America, the nationwide network of 200 food banks, which provide food and services to food insecure people in every county in the United States. I first want to thank members of the committee for your support of food banks in your districts. Every food bank is very appreciative of the support we receive from members of Congress, and we recognize your efforts to support the work we do. We have seen a tremendous increase in need as a result of COVID-19. This past fiscal year, Second Harvest distributed 9.9 million pounds of food, up 31% from our record distribution the year prior. There are no signs of this slowing down as we distributed 1 million pounds of food product in July, our first month of the new fiscal year. We understand that low-income families in general are vulnerable. One vehicle emergency or unexpected home repair can set a family back financially for months, and we know that low-income seniors often must choose between needed prescriptions and a nutritious meal. We are also mindful of racial disparities and the prevalence of poverty and food insecurity across demographics, as well as urban and rural disparities. Our focus has always been to support all families in need, and in doing so have worked to identify and address inequities in our service and distribution efforts. To address inequities, we recently closed our on-site pantry in an effort to focus more attention to mobile pantry distributions across our 19 counties. We learned that our poorest performing county, Leavenworth County in Kansas, is the county with the largest Black population. I'm proud to say our focus in Leavenworth County saw an increase in distribution by more than 72% in the past 2 years. Second Harvest also created partnerships with Native American populations in Northeast Kansas and has established food distribution programs on the reservations. Our goal is to reach all distressed populations, and the federal support we have received has helped us accomplish this. We have seen the benefit of food purchased through Families First and the CARES Act. Kansas Department of Emergency Management has purchased shelf-stable food packages for us to distribute, and we have seen increases in USDA commodity purchases to support the need. Even with these additional sources of food being provided, we are still purchasing significantly more product at a higher price than we did a year ago. We understand programs such as pandemic unemployment, housing, SNAP, and CFAP are temporary solutions and will eventually come to an end. I am concerned that as the federal relief programs expire, demand will remain high, as will the price to distribute food. Among the most important support we have received is that provided by National Guard members deployed to Second Harvest. The Guard has been assisting in all facets of our operations, including preparing disaster relief food boxes, distributing product at mobile pantry locations, deliveries of food, and other efforts to support food distributions. The National Guard has shown a commitment to safety at a time when traditional volunteers are on the decline because of concerns related to the pandemic. We also appreciate FEMA's response efforts, including efforts that made emergency feeding activities eligible for reimbursement under FEMA public assistance. The PPE that has been offered and provided across the country to support our personnel and volunteers has also been greatly appreciated. There does appear to be a lack of clarity about which incurred expenses may be reimbursable, as well as how partnering with the state or local government might impact our ability to receive reimbursement for emergency food distribution. We also heard concerns with the implication and overlap of services for individuals who would receive food through FEMA public assistance in addition to other federal services. For all the assistance we have received to support our pandemic response, the continuance of Title 32 funding to support deployment of the National Guard by the states is what would best support our efforts to continue our pandemic response. I would also strongly encourage states to consider developing proactive agreements with individual food banks and state associations so that when food banks are needed to support emergency food distribution efforts, we have the tools necessary to rapidly support the communities we serve. Through all the adversity and challenges, I'm proud to say our team at Second Harvest has demonstrated a tremendous effort keeping up with the demand. We are very appreciative of everything the federal government has done to help with our response and support vulnerable populations. And I hope you consider this testimony as an indication of what has been working well and ideas for how we can all be better in what we do. Thank you.
Thank you, Mr. Higdon. Ms. Roth, you may proceed.
Good morning, Chairman Titus, Ranking Member Katko, and distinguished members of the subcommittee. It is an honor to testify before you today as one voice among the 26% of the U.S. population who have disabilities. I too honor a man who was a beacon for me and so many others with disabilities. In that spirit, I am here to make good trouble. I am the Executive Director and CEO for the World Institute on Disability. I've been focusing on the intersection of disability rights, emergency management, disasters, and public health emergencies and disaster resilience since the 9/11 terrorist attacks almost 20 years ago. For almost 8 years, I served as senior advisor to FEMA Administrator Craig Fugate, establishing and directing the FEMA Office of Disability Integration and Coordination. Thank you for allowing me to share the experiences of people with disabilities during disasters, the topic of today's hearing. After so many years of effort, I wish I was here with better news. The Centers for Disease Control and Prevention reports that at least 1 in 4 adults has a disability. Like me, they have sweeping civil rights protections against discrimination on the basis of their disability and are entitled to equal access throughout almost all aspects of daily life in the U.S. These rights are never suspended or waived, including before, during, and after public health emergencies and disasters. Having a disability does not make people more vulnerable in disasters. Everyone is potentially vulnerable to the impact of disasters. What makes people vulnerable is the failure of communities and governments to plan for the inclusion of people with disabilities in every aspect of the disaster cycle, including community preparedness and disaster exercises, accessible alerts and warnings, building and community evacuation, sheltering and temporary housing, access to health maintenance and medical services, and all aspects of the recovery process. Chairman Titus, we can't even assure that service animals will be consistently admitted to shelters in a disaster, despite the obligation, training, technical assistance I and many others have been providing for years. Failure to comply with the ADA and other key civil rights laws is what makes people with disabilities more vulnerable in disasters and public health emergencies. While 8% of the country's COVID-19 cases have occurred in long-term care facilities, deaths related to COVID-19 in these facilities account for at least 43% of the country's pandemic fatalities. With 150,000 Americans dead, this means at least 65,000 people, almost all disabled, many Black, Indigenous, Brown, and other people of color, mostly poor, have died horrible deaths in the last 137 days, almost always without any loved ones to hold their hand. How can I say most of these people were disabled? Because no one ever goes to a nursing home or long-term care facility because they're old. They go because of the failure of their community and their government to provide adequate housing, support, and services in their own home, despite the requirements of disability civil rights laws. These 65,000 people with disabilities all had unwaverable rights confirmed in the 1999 Supreme Court Olmstead decision, giving them all the right to live in the most integrated setting appropriate to their needs, which was clearly not in the COVID-infested death pits in which they gasped their final breath without loved ones by their side. It's too late for them, but not for the millions of others. According to a New York Times database, as of July 23rd, the virus has infected more than 335,000 people at some 15,000 facilities. This includes people who are in prisons and in detention facilities. We have many asks in our testimony, but most particularly, we asked for immediate passage of the bipartisan, bicameral, Real Emergency Access for Aging and Disability Inclusion for Disasters Act and the Disaster Relief Medicaid Act. And we ask you to help us find out who is monitoring and enforcing FEMA and HHS's use of disaster funds to ensure that every federal dollar spent or granted to others to spend are in full compliance with all of the obligations under the Rehabilitation Act of 1973. We can't seem to get that answer and can't seem to get an answer for who is responsible for monitoring the folks who are supposed to be monitoring the expenditure of billions, perhaps trillions, of taxpayer disaster funds. I have many individual examples I wish I had time to share with you today.
Well, thank you. Perhaps we can get to some of those examples in the questions. We appreciate your testimony very much. Ms. Yentl?
Yes, Chair Titus and Ranking Member Kotko and members of the subcommittee, thank you for the opportunity to testify before you today. The National Low-Income Housing Coalition has worked on disaster housing recovery for 15 years since Hurricane Katrina, and from this experience, we have reached a simple conclusion. America's disaster housing recovery system is fundamentally broken. It consistently exacerbates the housing crisis, solidifies segregation and racial inequities, and deepens inequality. When disasters strike, the lowest income and most marginalized people are often hardest hit. They have the fewest resources and face the longest, steepest path to recovery. Yet these are the households that are least likely to receive FEMA assistance. FEMA prioritizes protocol over outcomes. relies on programs that are inaccessible or unhelpful to low-income people, creates unnecessary and arbitrary deadlines, and refuses to release data on program requirements or outcomes. FEMA has consistently failed to learn lessons from past disasters and to apply them to future efforts. A clear example is FEMA's refusal to activate the Disaster Housing Assistance Program, or DHAP, which Republican and Democratic administrations have upheld as a best practice to help families find permanent housing solutions. Instead, FEMA relies on programs that low-income and marginalized families struggle to access and use. As a result, homelessness often increases in communities impacted by disaster. After Hurricane Maria, FEMA implemented arbitrary deadlines that required Puerto Ricans that evacuated the island to leave FEMA-funded motels before they had alternate housing. As a result, homelessness increased in communities with Puerto Rican evacuees by 14% in Massachusetts and 17% in Connecticut. After Hurricane Harvey, homelessness increased in Houston by 18%. Nearly 20% of people experiencing homelessness in the city reported that they had become homeless as a result of the disaster, a stunning indictment of the failed disaster response. FEMA-funded programs exacerbate racial inequities. After Hurricane Harvey, nearly half of disaster survivors with the lowest incomes, mostly people of color, were denied FEMA assistance. The vast majority of higher income, mostly white households were approved. The average white family in the higher income neighborhoods received about $60,000 per person. Black families in poorer neighborhoods received an average of $84 per person. FEMA frequently denies assistance to eligible survivors because of inflexible requirements. For example, title documentation rules bar low-income homeowners, residents of manufactured housing, and renters without written leases from receiving the assistance for which they are eligible. After Hurricane Maria, FEMA denied assistance to at least 77,000 people because of otherwise accepted informal systems for documenting homeownership. Rural, historically Black, or immigrant communities also implement informal systems of homeownership. After Hurricane Michael, FEMA denied assistance to as many as 50% of applicants in certain parts of the Panhandle due to title issues. After California's wildfires, FEMA denied assistance to 70% of applicants due to title issues. In all cases, FEMA refused to modify its program to accommodate applicants and needs. FEMA has known this issue is a problem since 1995 and has done little to remedy it. FEMA has a systemic lack of transparency. The agency refuses to make information public about its application and appeals processes, which leads to higher and often shocking levels of denial rates for low-income people. People experiencing homelessness are often most at risk during a disaster and have the fewest resources to recover, but they are denied FEMA assistance even if all their belongings were destroyed by the disaster. These are just some examples of our country's broken disaster recovery system and the ways in which it neglects the people most in need of assistance. And my written testimony has many more examples and evidence. Congress should rebuild a disaster housing recovery system that is centered on the needs of the lowest income people. Racial equity and equity for all marginalized and impacted people should be a central and explicit goal of federal disaster policy. There must be opportunities for public engagement, systemic transparency, full accountability, due process, robust civil rights enforcement, fair mitigation practices, and a focus on increased local capacity and benefit. These priorities must be reflected in every stage of disaster recovery and response. This work will take many years, but Congress can take action immediately. Excuse me. Congress should permanently authorize the DHAP program and activate it after every major disaster. Congress should require FEMA to activate it now for those people experiencing homelessness that have been moved to hotels to contain the spread of COVID-19. Congress should enact the Housing Survivors of Major Disasters Act, which passed unanimously out of this committee and would help overcome title documentation issues. And Congress should require that FEMA provide basic, essential information about its response and recovery efforts, including full transparency on program eligibility, the application process, reasons for denial of assistance, and outcomes. Decades of evidence makes clear that our country's disaster housing system is fundamentally broken. Congress must develop a new system that centers the housing needs of the lowest income survivors, including people of color, people with disabilities, and others. Thank you again for the opportunity to testify and for holding this important hearing. I look forward to your questions.
Thank you, Ms. Gentle, and thank all of you for excellent testimony, laying out the statistics of how this community is affected, and also some of the reasons why it's so affected. We'll now move on to member questions. Each member will be recognized for 5 minutes, and I'll start by recognizing myself. You know, this committee did some good work expanding FEMA assistance for the disability community in the Disaster Recovery Reform Act. But based on your testimony, there's clearly additional room for enhancements to how FEMA evaluates disaster aid for vulnerable communities. Mr. Brown, you said that you had some suggestions, and we've heard some others mentioned, but I wonder if y'all would speak directly to what can be done and put it in the context of, is it a problem of law, is it a problem of policy, or is it a problem of politics? Does it change depending on who is the administrator or what those priorities of the administration are? Start with you, Mr. Brown.
Thank you, Chairwoman. You know, my perspective is that these problems are systemic. So they are a problem of law and policy and also implementation. Equity has to be fully integrated throughout the entire process, and especially implementation when a disaster occurs. So one of my recommendations as part of my written testimony is a full and thorough vetting of all of FEMA's policies, practices, and grant programs to look at how we can integrate equity and prioritize the needs of the most vulnerable, and cut through the red tape and the delays that disproportionately impact the communities that are most at risk, and most in need when a disaster strikes. So just to answer your question, I think it's systemic, it's deeply rooted over many years and time. And in order to change the trend that we see continuously, we need some intentional efforts, a lot of investment and focus, and we also need a diverse profession. We also need to add diversity into the field and add additional perspectives to commit to long-term change.
I noticed that in the field of emergency management, there's not much representation from people of color, from women, from people with disabilities, especially at the top levels of management. And don't you think if we were more open in our recruiting and in our promotion within the agencies that deal with these problems, that might have some impact?
Yes, Chairwoman, that's vitally important at all levels and throughout the emergency management enterprise. To your point, the field is not diverse, but it is growing. There's a unique opportunity here to diversify the field of emergency management, more women, more people of color, especially in positions of leadership. We've been working with historically Black colleges and universities, as well as minority serving institutions to increase the number of students who are interested in the field. We need to look critically at the skill sets needed in the field. We need to bring in folks who understand a human-centered approach to disasters and understand the communities that are most impacted. And I think we can get the best bang for our buck if we do that. Right now, we have a field that is not diverse, who cannot fully understand the unique experiences of the communities that are most impacted. And so yes, that is a huge part of the problem, but diversity and inclusion is a part of the solution.
Thank you, Ms. Ross. Ms. Roth?
Yes, there are so many opportunities for improvement. First and foremost, we have got to resolve who has the responsibility for monitoring and enforcing federal laws that are now 30 years old. Thank you for recognizing the ADA anniversary, and almost 50 years old with regard to the Rehabilitation Act, which applies to the use of every federal dollar, whether it's expended by the government or whether it's granted or subgranted. And so we address many of these shortfalls, failures, and unfortunately, those with dire outcomes. We address those in the READY Act and the Disaster Relief Medicaid Act. The issues at FEMA are quite honestly baffling. We had hired 175, 155 disability integration advocates to deploy out into the field disasters, to support governors, support states, support disability organizations, to navigate the complexities of FEMA's programs. Most of those were people with disabilities, and unfortunately, most of those are no longer working for FEMA.
Thank you.
So-
I'm afraid I've got to cut you off. My time is up, but I would like to come back to that if we could. Thank you.
Great.
Mr. Katko?
Thank you, Madam Chair, and thank you all for your testimony today. And just a quick example, I met a young woman in my district years ago who had Down syndrome, and I had her come down to speak at an event. She did such a good job that she became the first person with Down syndrome to be registered as a lobbyist for the National Down Syndrome Society. So the point is that when they get an opportunity, that's often all they need. And we got to keep that in mind. And so opportunity is what the name of the game is, as far as I'm concerned. So I credit all your advocacy and what you're saying in that regard. Mr. Higdon, the Central New York Food Bank, just in a 4-month period from March to June of this year, has distributed over 8.4 million pounds of food, or over 7 million meals, had 73 mobile food pantry distributions, received over 4,000 requests for assistance, and pre-screened 3,400 households for assistance. They accomplished this with 445 volunteers and 27,000 staff hours devoted to their COVID efforts. Food banks are critical to addressing food insecurity, as you know. And what is the best way, Mr. Higdon, that we can continue to ensure food banks like yours in Central New York have what they need to continue to meet the needs in these very trying times?
Yes, Ranking Member, I appreciate your comments in support of the food bank. They spoke very highly of your efforts to kind of stay plugged in with what they're doing. For us, we've seen a lot of success with our mobile pantry distributions. It's really been an opportunity for us to do drive-through distribution, so individuals don't have to get out of their cars. You're seeing this across the country. It's very a lot of dignity provided and through those opportunities where we're not doing a lot of income intake. We have a lot of opportunities with food that's been provided to us right now, and so for us, really the support that's been most helpful in order for us to increase our distributions has been use of the National Guard. We have been blessed with there's been a lot of private donors who've responded and been helpful, and support from the government and things that are happening, and who knows how long this is going to go, and what's needed to really support the needs long term, because some of these programs will run out. But for now, it seems like we're doing a good job of trying to keep up and dealing with adversity and trying to keep our doors open and reach as many people as we can. And I think one thing that our Feeding America network really has is that opportunity to provide coverage throughout the country. Every county in the United States is covered, and we have a pantry established, multiple pantries in every county that we serve. And so really just through our reach and opportunity, we're trying to reach as many people as we can, and the support we've seen from the federal government has really enabled us to get out there and help really anybody that needs it through everything that's going on right now.
Thank you, Mr. Higdon. I'm glad you mentioned the National Guard, and I didn't know you were going to do that, of course, but my son is a lieutenant in the National Guard, called up to active duty, and he was serving in underprivileged communities, and it was quite an education for him. And he commanded a testing site, so I can testify firsthand to you that the National Guard was a great help, and I'm glad you mentioned that. Switching gears here to all the other members, or the other witnesses, I want to note that this committee has worked over the years to ensure the emergency management system works for all people hit by disaster with a particular focus on the most vulnerable. Ultimately, we must make sure what assistance is available is clear and communicated effectively, and that the process itself does not re-victimize the victim. That means removing unnecessary red tape and hurdles. I appreciate all of your included recommendations in your testimony, but what I want to do in the time that's left is to try and get at least one or two of you on the record telling us what would be your top one or two actions you would recommend, the top one or two, briefly, that would improve delivery of assistance to vulnerable populations. And we can start with Ms. Roth.
My top one or two would be ensuring that the monitoring and enforcement of the federal laws is occurring without interruption, and as well that the local disability-led organizations are able to provide services before, during, and after disasters and be appropriately funded for them. At this point, we have independent living centers across the country who are providing their services without reimbursement, not because they wouldn't be eligible for that reimbursement, but because they are dependent on their states to facilitate the process. So we need to correct that in the public assistance emergency protective measures.
Thank you very much. We're out of time, but for the other witnesses, I would ask you just, if you could just submit something in writing, I'd really appreciate it, because I want to know what we need to prioritize and what you believe the priorities are. And sorry I couldn't get you all, but we ran out of time. And I yield back, Madam Chair.
Thank you. We'll now go to Ms. McCarsell-Powell.
Yes, thank you, Madam Chair, and thank you to all the witnesses for coming this morning. Ms. Intel, I wanted to start with a question about housing. As you know, the moratorium on evictions is about to end, and that means that many Floridians will find themselves without proper housing through no fault of their own. I would imagine this would seriously exacerbate the tragedies in South Florida if it's hit by a strong hurricane. And just this morning, I saw that there's already a tropical depression that may be hitting us in 5 days. So can you please speak on how this will affect people's ability to get FEMA assistance?
Absolutely. It's a tremendous concern. The federal eviction moratorium has expired, as you say. State and local eviction moratoriums are expiring rapidly. Where state and local officials have been able to cobble together emergency rental assistance programs, they too have been depleted very quickly. And many communities, like in Florida, were suffering from a severe shortage of affordable homes even before COVID-19 came. So the potential for an eviction wave in a state with a severe lack of affordable housing available as a hurricane approaches is devastating and could be catastrophic. And I think it points to both the need for immediate congressional action to prevent this wave of evictions through a federal moratorium on evictions, through $100 billion in emergency rental assistance, through assistance to homeless shelter and service providers. And it also points to the need for those households who were homeless before COVID-19 and have been moved into hotels through FEMA's reimbursement for non-congregate shelter. We have to ensure that as those programs end, that we are moving people from hotels into permanent housing, not back onto sidewalks or encampments or in homeless shelters, again, which would be devastating in the middle of a storm.
Mm-hmm. Yeah, thank you, Ms. Intel. And as you know, we actually passed the HEROES Act, including that rent and mortgage relief to prevent evictions. And the Senate Republicans came back without including that provision, which just seems cruel, especially in my state where we have such a serious crisis where people are facing evictions now. Thank you so much. And Ms. Roth, I wanted to highlight the fact that 2 days ago, July 26th, was the 30th anniversary of Americans with a Disability Act becoming law. Over the past 3 decades, this law has made a world of difference for so many of my constituents and people across this country, but we still have so much work to do to ensure that individuals with disabilities are treated fairly, that they have access to everything that our communities have to offer and receive sufficient protections and assistance when disaster strikes. And we all know someone with a disability, whether it's a family member that has had a disability since they were born, or a friend who got into an accident and then was faced with a disability. Ms. Roth, approximately, like you said, 26% of the US population has a disability, a quarter of our population. But somehow this fact is far too often overlooked. My nephew Charlie, whom is so close to me, he has serious disabilities that require him to live in a special group home. And they provide him with expert care. His caregivers, actually, I have to say, are angels. I've had several conversations with them about how they're dealing with this pandemic. They've told me that they can't get the proper testing for their residents because they're bedbound or are in wheelchairs. They fear the day when a hurricane forces them to evacuate. They feel forgotten. In fact, the owner and general manager of the organization that cares for my nephew stated, and I quote, "Nobody thought about group homes." Ms. Roth, as you know, CMS has instituted strict reporting requirements for nursing homes. COVID cases must be reported to all residents and families, as well as directly to the CDC and state and local officials. This data is important to stop the spread of COVID. Do these same reporting requirements apply to facilities that care for individuals with intellectual disabilities, or psychiatric residential treatment facilities, or substance use disorder treatment facilities?
Thank you so much for those questions. And unfortunately, even where there are now finally some requirements, we're still not getting accurate information. It is just completely baffling to me that we cannot identify where this virus is emerging in hotspots, and make sure that everyone, including people with disabilities, have what they need in order to protect themselves. Just yesterday, the Senate bill completely left out any home and community-based services funding. It is that kind of funding that makes it possible for people with disabilities and their families to have the supports and services that they need, and to keep them out of the congregate facilities that are unable to keep people safe.
Yes, Ms. Roth, it's so troubling that they want to, now when we need that support the most, we're facing those cuts. How does the lack of data and the lack of transparency affect the emergency manager's efforts?
We're going to have to move on to the next person, but we'll maybe have a second round.
Yeah, I couldn't see the clock.
It's okay.
I couldn't see the clock, but thank you so much. I yield back.
Thank you. Ms. Miller?
Thank you, Chairwoman Titus and Ranking Member Katko, and thank you all for being here today. This hearing is extremely relevant to my state of West Virginia. We have people living among the hills and hollers, high up, down in valleys, along floodplains. Many of our people are low-income individuals, and we have a high population of the elderly and disabled. I cannot express how pleased I am to see you here today, because we need to address and improve these long-standing issues that will touch my state for generations to come. Mr. Brown, when working with your state, you mentioned that you examined at-risk communities that may not have applied for assistance. How do we ensure, for example, that the rural at-risk communities can receive the proper outreach education with the paperwork, the application requirements, and the eligibility status?
Thank you, Congresswoman. I really think we need to look at, what the word equity really means. And it means that not all of us need the same amount. It's not equality, it's giving what people need. There's some communities that need more. And so when it comes to rural communities, a lot of the rules and regulations associated to assistance or applying for grants takes a lot of work, and they have limited staff and capabilities to do that. We need to adjust those rules and regulations to be equitable and to provide the necessary support and funding to support those rural communities that have unique issues. A lot of communities are spread out. We've had rural communities that need additional resources in terms of masks and hand sanitizers, for instance, related to COVID-19. So we've dedicated supplies specifically for these communities and created a program to deliver those right at people's doors, to give it right to the most vulnerable communities. And so I really think we need to change our practices in order to provide additional resources and support to those rural communities.
Well, who do you think is best positioned to do this? And do you think state and local emergency managers should have a greater role?
Yes, I think state and local emergency managers should be given additional resources and the ability to do that. But again, when we look at how to dramatically change the issues related to integrating equity in emergency management, it takes all levels of government in order to do that effectively and to stem the current trend of disasters with the disproportionate impacts on underserved communities.
Okay, Mr. Higdon, 37 of the 55 counties in West Virginia are classified as either at risk or distressed. These counties rank in the worst 25% of the nation's counties, according to economic status indicators. I am so proud of our food banks in my state and the work that they do. We also have used the National Guard, and we just always are trying to improve. From your experience, what lessons could you share today that might be helpful to some food banks?
One of the things we do very well, I really appreciate the time, Congresswoman, is collaboration. When we look at our network, we get together often. We have a lot of right now virtual conferences happening this week, and we're learning from each other and understanding, dealing with food banks that have had a staff member test positive, or trying to manage volunteers through all this process. And I think we're all figuring everything out as we go, and it's we're learning on the fly, and we're continuing to get better, and we're going to be better because of this, unfortunately. Really, when we look at what's happening, I think when I see food banks in Missouri, the ones that haven't been using as much of the National Guard and have volunteers, we're seeing a decline of volunteers on the CFAP product and some of our parents. We have logistic limitations with our food pantries. Not enough refrigeration and coolers all the time. Right?
Okay, I'm going to have to move on. I'm so sorry. I have a question for Mr. Roth. From my understanding, FEMA operates a system called IPAWS, which is the Integrated Public Alert and Warning System. For example, that technology alerts to include not just text, but pictures or data or even signals. How do we continue to implement and modernize emergency management systems like IPAWS for our vulnerable population?
Thank you for that question. I think, first and foremost, all of the federal agencies need to be providing information in accessible formats. It is their legal obligation, and it is imperative that people have information in formats that are accessible to them. Information that is that's not accessible is not actionable. So, for instance, we've been trying for a very long time to get NOAA to caption their videos, to audio describe emergency information so that people are in a position to make decisions about their safety, the safety of their family and their neighborhood. We have just some real basic work that's been in the law for many, many years and needs to be implemented. IPAWS goes a very long way in modernizing a system that is now, almost 60 years old. And it really needed to be modernized, and it was very important to be inclusive of a variety of information delivery systems. That's the information that's being is actionable, we are still going to be able to give the whole community information that they can use in times of disaster.
Thank you.
Thank you. I yield back.
Thank you. Communication does seem to be an issue that we need to address, whether it's another language, whether it's for sight impaired, whether it's lack of internet in the rural parts of the state. If you can't get the information out, then you can't provide the service because people don't know it's available. We certainly do need to work on that. Ms. Norton? Recognize Ms. Norton for 5 minutes.
Thank you very much, Madam Chair. Very much appreciate this hearing, which is raising issues that have been far too below the surface. My first question is, I believe, for Ms. Yentl, because in preparing for this hearing, I was surprised to find that there is actually a regulation that says unless people were made homeless by a declared disaster, that they're not eligible for Stafford Act release. One, I wonder, is that still the regulation? And two, what happens to homeless people who are homeless anyway during a disaster?
Yes, thank you for the question. So FEMA believes and implements programs that assume that people who are experiencing homelessness prior to a disaster are not eligible for any FEMA assistance after the disaster. That's even in the case of a person who was experiencing homelessness, maybe sleeping in an encampment, and maybe a hurricane destroyed all of their belongings. Directly, they lost their belongings as a result of the hurricane. Still, FEMA would say they are not eligible for assistance, and very often they receive none. In some cases, FEMA has taken that so far as to say that people experiencing homelessness prior to a storm are not eligible for emergency shelter during and that was the case in the California wildfires, where people were literally in the path of fire, destruction. And FEMA interpreted the law to say you were homeless before the wildfire, you couldn't go to emergency shelters during. Now, it's especially interesting to note that FEMA is now interpreting the law differently and is finding that due to COVID-19, people who were homeless prior to the disaster can be eligible for non-congregate shelter. And it's good that they are, but it shows that they can interpret the law much more broadly than they do to apply to all people before and after disasters.
I appreciate that answer, but Madam Chair, I believe that this committee should make clear that the regulation, which they apparently the pandemic has forced them to broadly interpret, does in fact interpret this way with respect to homelessness, period. Ms. Roth, another surprise I found by looking at what the GAO had, this is for Ms. Roth, that the registration process for FEMA's registration process does not ask as an initial question directly an individual if that individual has a disability or if they would like to request an accommodation for completing the question. That surprised me to read about that. Could you explain what if that is true and what should be done about it?
Sure. For many years, that was absolutely the case. Happily, about a year and a half ago, the GAO listened to those of us who were repeating this concern, and many members of the House and Senate asked the GAO to take a look at this. FEMA has subsequently made a small change in the wording of the application does in fact use the term disability and gives some additional examples before. But those are very inadequate, and there is still no way for a person to request in this application FEMA assistance. So if you need an accommodation to get through the application process, there's no way to ask for it. You need a sign language interpreter to come out when your house is inspected. The only way you can ask for that is in you call. You get to the notes. You need a sign language interpreter, and then maybe the sign language interpreter will be there when the inspector comes out. Adding this, I have been told for years, it's too hard because the Paperwork Reduction Act made it difficult to add this legally required question. And throughout the time that I was in, we're never able to get it.
Thank you. Thank you.
Thank you, Madam Chair. Again, if I could ask that FEMA be required or asked to ask the question. If they won't ask the question directly, they're not likely to get a response. Thank you very much.
No, thank you, Ms. Norton. Next, we'll have Mr. Palmer.
Thank you, Madam Chairman. I'm not sure we can hear all of Ms. Roth's answers, but I do appreciate her concern for the elderly people who are in nursing homes and other facilities like that. And I just wonder if your organization has made any attempt to investigate or work with governors and other officials where we've had a disproportionately high number of deaths. I mean, there's 5 eastern states, Pennsylvania, Massachusetts, Connecticut, New Jersey, and New York, that account for almost half of all of the nursing home deaths. We know the controversy involving Governor Cuomo in New York and sending recovering COVID-19 patients back into nursing homes and not having them tested. You add in Illinois and Michigan to that, and that's well over half of all of the COVID-19 deaths in the nursing homes. Has your organization looked into that and raised any concerns with any of those administrations in those states?
Thank you for that question. We are part of a national coalition with folks active in not only every state, but just about every congressional district. And we have approached the governors. We've recently, under the leadership of the Association of Programs in Rural Independence, or Independent Living, sent a letter to the National Governors Association. We haven't yet had a response. We had, as early as March 3rd, sent out a call to action that was signed by 192 organizations that called on the federal government and the state governments to act immediately to protect people with disabilities, older adults, other people who were identified as, having underlying conditions.
Ma'am, let me cut you off there. I just want to make sure that we have a proper focus on the states where there's been a disproportionate number of elderly die under the administrations of these 7 states. Ms. Yentl, as you point out in your testimony, community-based organizations and local businesses are usually positioned to know the unique needs of a community they serve and can assist in a number of areas, employment in the area that's been hit by disaster. How do we ensure assistance and contracting takes this into account? And again, specifically community-based organizations and private nonprofits.
Sure, thank you for the question. If FEMA were to require that any kind of contracting take into account and go first to local businesses, and especially businesses owned by women and people of color, and be embedded in the community, then that would have the benefit of supporting those local small businesses and also ensuring that the assistance that those contracts are providing are actually meeting the local need, because those local nonprofits and local businesses will be best equipped to know what their neighbors need.
Do you, both you and Mr. Brown, in your testimony, obviously place a high value on inclusion when it comes to disaster relief. Do you have representatives from groups with stellar reputations in disaster relief, such as Samaritan's Purse and the Southern Baptist and Catholic Charities, that are faith-based? Are there any things that would preclude utilizing those organizations? And what is of the greatest importance to you, inclusiveness or effectiveness in meeting the needs of victims of a disaster?
Thank you, Congressman. I think we cannot be effective unless we're inclusive and equitable. So I think the whole
think you can be
emergency management.
effective? You don't think you can be effective? What I'm asking is, do you have any animus toward any organizations like Samaritan's Purse and Southern Baptist? We saw that, particularly in New York with Samaritan's Purse, and certain groups didn't want them there because of their beliefs.
I don't have any animus towards any group that wants to help, but I think every group that comes in to help needs to respect and understand the community and be inclusive and equitable. And this is where diversity, equity, inclusion training is so important in order to be effective when it comes to disaster response. And that's whether it's a federal, state level, nonprofit, or private entity.
Well, that 5
And I would
minutes
just
went
add, if I
fast.
could.
I think my time has expired.
Okay.
You can answer the question, though, if you'd like, Ms. Schentel. I think.
Okay, I would just add, if I could, I don't know those specific organizations and certainly have no animus towards faith-based organizations and their value in disaster assistance and recovery.
You're not familiar with Samaritan's Purse or the Southern Baptist Relief? I mean, they're the largest relief organization, I think, in the country, or they were at one time.
I'm familiar with the national organizations, but not the local chapters, which I thought was what you were asking about. But I would just say that assistance has to be available to everybody who needs it without requirements put on that assistance. And there have been cases, especially when it comes to people experiencing homelessness, where faith-based organizations may want to put additional requirements on the assistance. And that's, in our view, that's not acceptable.
Thank you.
Yield back.
Mr. Carbajal.
Thank you, Madam Chair. First, I'd like to ask for unanimous consent to insert this letter from the food banks of Santa Barbara County into the record. My staff will also email it appropriately. Mr. Higdon, first of all, I want to thank you and everyone else on this panel for the incredible work you have done to help those most in need, and remember the 145,000 lives that have been lost during this pandemic. As this public health crisis continues, we are seeing more and more people lose their jobs and struggle to put food on the table. The Hamilton Project estimates that rates of households facing food insecurity have effectively doubled. I know the administration has taken some steps to address some of these challenges. For example, earlier this year, FEMA issued guidance that made some emergency dollars available to feed hungry Americans. Has this been enough, and has the guidance been clear? And two, how can we partner with you and other food banks across the country to make sure no child or senior citizen goes hungry because of language or mobility barriers?
Yeah, thank you, Congressman. I actually asked feedback from the food bank in Santa Clara. It seems like, especially in California, there was some miscommunication as in terms of FEMA providing public assistance and then claiming any kind of food distribution expense reimbursement, and whether families would, whether they were SNAP participants or receive federal commodities, and whether they would be eligible to receive some of those, the food purchase through federal assistance funds. So I think there could be some better communication and clarity on how some of those programs work. I know here in Missouri, we got a lot of confusion in terms of, we heard that you had to sign a MOU with a local government entity to receive reimbursement for food expense. But there really wasn't clear guidance. We were trying to see if the state emergency management agency would actually do a statewide partnership with our food bank state association, and that never really came to fruition. So there's a lot of kind of uncertainty as to whether we can claim reimbursement or what expenses are eligible and how it ties to other federal programs that we operate. So we do have one MOU with the local county government, but haven't really tried to seek reimbursement for any of that. So I think there could be better clarity in terms of what's happening. And really my concern as we move forward is really what's going to happen long term with some of these other, the CFAP program might, is going to end at some point, and pandemic snaps going, other benefits are going to start to run out, and still a lot of people out of work, and unemployment is still going to be high. So as those people lose some of the assistance they're receiving, are they going to need additional assistance? So we are trying to best plan and prepare for the long-term outcome. And right now we're getting a lot of support. It's hard to tell kind of what the future needs are going to be and how that response is going to be sustained.
Well, I hope in the future, when we're able to, we can reflect back and enumerate all these challenges so that we could work on them, work to resolve them so that we can avoid these challenges in the future. Ms. Yentl, thank you for your testimony today. You know firsthand the barriers Latinos, other communities of color, those with disabilities, and seniors face during disasters. In my district, we learned this when a debris flow killed 23 people and nearly half of them were immigrants. There were language barriers, equity issues, and red tape survivors had to navigate. From your perspective, what are some recommendations this committee can help implement to address equity issues and reduce the amount of red tape families face in trying to access the help they need following a disaster? And two, are there changes we can make to FEMA to ensure we are learning from past disasters?
Yes, thank you for the question. So I think two of the most important things that you can do immediately to eliminate some of the challenges that low-income people face when they're trying to access resources is, one, require that FEMA provide full transparency for its programs, to have publicly available information on what programs are available, who is eligible, how they determine eligibility, how they determine acceptance or denial, and what the process for appeals are. It's shocking to me that this basic information is not available from FEMA now. In fact, the National Low-Income Housing Coalition submitted a FOIA request a year and a half ago asking for some of this basic, very basic application information, and we still have not received it. And the fact that that information is not publicly available makes it very difficult for low-income people who are denied assistance to know why they were denied, and to have a process in place for them to appeal that denial and ultimately get the assistance to which they are entitled. Another tremendous challenge for low-income people, especially in rural areas, especially people of color, is this title documentation issue. And FEMA has been unnecessarily rigid for decades on requiring this formal title documentation from low-income homeowners in order for them to receive the assistance, even in communities like Puerto Rico or like in many Black and brown rural communities where informal documentation is what's typically used and accepted in all other cases. As an example, in Puerto Rico, 77,000 low-income homeowners were denied assistance. Many of them have still not received assistance because they don't have formal title, which the island of Puerto Rico does not require for any other purpose. And FEMA was willing to work with some advocates in Puerto Rico, especially Ayuda Legal, to create what they called a sworn declaration so that Puerto Ricans could prove that they own their home. But now FEMA has refused to use that sworn declaration in any meaningful way. They won't post it on their website. They won't send it to people who were denied assistance. So these are two really essential and I think very basic things that the committee can and should require FEMA to do: full transparency of program data and outcomes, and to fix the title documentation requirements. That the committee and Congress should require FEMA to implement the Disaster Housing Assistance Program, or DHAP. Both Republican and Democratic administrations in the past have pointed out this program as a best practice for longer-term housing needs of low-income renters. But FEMA under this administration has consistently refused to use this program to the detriment and harm of low-income.
Thank you, Ms. Gento. My time has expired. I yield back.
Thank you. Mr. Pence?
Chairman Titus and Ranking Member Cato, thank you for holding this hearing, and thank you to the witnesses for being here today. I would also like to thank FEMA for the incredible support they have shown to local, state governments during COVID-19 pandemic. The most recent numbers show that FEMA has delivered over 1.5 million N95 respirators, 860,000 gloves, 187 face shields, and 440,000 surgical masks to frontline workers in my home state of Indiana. In my district, we're proud to have a Second Harvest food bank in Delaware County. As the region's largest hunger relief organization, Second Harvest Food Bank has worked with local, state, federal, and corporate partners to ensure that all Hoosiers have access to nutritious meals. Mr. Higdon, as you mentioned in your testimony, FEMA supported the delivery of meals for approximately 6 weeks as donations decreased at this facility in Muncie. Overall, FEMA has obligated to our state over $55.5 million in federal support for Hoosiers in need, mainly in at-risk communities. Back in April, several of our local food pantries joined forces at Lucas Stadium in Indianapolis to distribute 40,000 meals per week to hungry Hoosiers, and this would not have been possible without this critical FEMA funding. While COVID-19 presents unique challenges, I applaud FEMA for swiftly moving resources to protect our public health and safety. Thank you, FEMA, for being there and showing up during the pandemic. And Madam Chair, I yield back.
Thank you, Mr. Pence. Is Mr. Garamendi with us? No? Okay, well then we'll go to Mr. Garcia.
Thank you, Madam Chair, and Ranking Member Katko for that very warm welcome. I appreciate it. I'm honored and humbled to be here in this committee during this very important time in our nation's history. I want to thank you all for your collective testimony. As a federal agency, obviously FEMA has a lot of opportunity to get better. It has a lot of opportunity to improve its efficacy, to improve its efficiencies, and also to improve itself and evolve with more diversity and inclusion. So this is a very important topic. It's a topic that we all benefit from. It's not just the individuals, but the organization and the country as a whole. When we involve more people, when we have more diversity, not only in demographics, but also in thought. So a very noble topic to be addressing today. Mr. Brown, look forward to your leadership in the emergency management position that you're in. As a minority myself, both in the military and in the corporate world and now in Congress, I recognize the value of having role models to look up to, those to inspire us, to also develop new talent, to advocate and promote within, and I have no doubt that you'll be successful in that matter. Mr. Higdon, thank you for leading this noble cause. I believe personally that we can't solve all of our problems on the back of the federal government, state or local governments, that it does require the nonprofits to be organized, to be effective, to raise money, and also be engaged in the local communities. And your partnership with the National Guard is a testimony to a very successful effort, and I look forward to learning more about the organization But I do believe firmly that the nonprofits, churches, and the charities in our communities are just as effective in many cases as government entities. So applaud your efforts there. Ms. Roth, I'd just like to simply echo Mr. Palmer's earlier comment about the decision by many of our governors. I come from California, where roughly 40% or so, nearly half of the deaths in our state were related to a decision by our governor to place senior citizens back in nursing homes after they were already either diagnosed or had symptoms of COVID-19. I resonate with the comment that you made that the folks in nursing homes aren't there because they're old, they're there because they have disabilities, and it's probably aggravated by their age or mental health challenges that they also have. So to that end, we'll do our research as well, and we'll continue the press, but I would love to have your support and partnership in our pursuit to hold the governors accountable for these decisions. They really did make decisions that cost the lives of many folks that didn't need to die. So I look forward to not only offering my support for your organization, but also soliciting your support as we look into these decisions that were made. I'll get to my question now. It's pretty simple, and frankly, it's a yes or no question. With all federal agencies, like I said, we have opportunities to get better. With all nonprofit organizations or any organization for that matter, we have opportunities to get better. Are you all taking the time to document the lessons learned that you're experiencing as we all collectively navigate through this uncharted waters called COVID? This will probably, unfortunately, not be the last time we have to deal with something like this. So my question, and it really is just a yes or no answer, are you taking the time to make sure that you're evolving your respective organizations and making observations of the organizations around you and also those that you partner with to make sure that next time we're faced with this, we're baking in these new lessons learned, we're evolving as a country, as organizations, as Americans? And I guess, Mr. Brown, we'll start with you.
Yes, Congressman. Baking in the lessons learned, I think they'll help us with the next disaster, but they also will help us with recovery, because it's very important that we recover equitably from this unprecedented disaster as well.
Thank you. Mr. Higdon?
Yeah, absolutely we are. Thank you.
Thank you. Ms. Roth?
Thanks for the question. The Partnership for Inclusive Disaster Strategies, who I am very involved with, has been working on a report. We don't call them after action reports, and we don't call them, we don't call them lessons learned reports, because apparently we're not learning too many lessons. So these are after action reports that are full of recommendations. The Partnership for Inclusive Disaster Strategies has been bringing folks together from across the country every single day, 7 days a week, since February 28th. And we've documented every bit of what we've been doing together. Hundreds and hundreds of disability organizations have been working together to make the changes that we can't quite seem to get the government to make.
Yeah, and that's the crux of the issue that I'm getting at here, and I look forward to seeing all of the data on the backside. And Ms. Yensel, I'm assuming you are doing the same?
We are, as we have for every disaster since 2005, and documenting the evidence of what's working and what's not. Our challenge is that FEMA rarely implements or takes into account any of the best practices or lessons learned, and that's where I think we need Congress to really require that they better embed the lessons learned so that moving forward, we don't continue to make the same mistakes.
Thank you all. We'll stay in contact, Madam Chair. Thank you.
Thank you. And it's interesting, we've heard several of the states mentioned in the need to do better in nursing homes. We haven't heard about Florida, Texas, and Arizona, however. We also have a large number of seniors, and they have the highest rates of the COVID. So let's keep in mind how we might be able to help those populations as well. We'll now go to Ms. Gonzalez-Colon.
Thank you, Madam Chair. And thank you all the members of the panel. I need to first, Chairman, ask unanimous consent that the report preserving our freedom, ending institutionalism of people with disabilities during the after disaster issued by the National Council on Disabilities can be entered into the record. Thank you, Madam Chair. And now, having said that, I need to ask Mr. Roth, would you say that this report is an accurate assessment, or better to put it, a comprehensible best practices for care for individuals with disabilities during and post-disasters?
In the interest of full disclosure, I was the principal investigator for that report.
Okay.
And yes.
So I assume the answer is yes. The reason I made this question, in the case of Puerto Rico specifically, 38% of the island we have people with disabilities, and that's 12% higher than the average in the nation. And having been affected by hurricanes, earthquakes, and now the pandemic, this population is being affected directly many times, and that was the reason of my question. Do you think, what else, what are the top challenge you see for seniors? Now I'm adding seniors and people with disabilities following a disaster. Can you just name 5 of them on the top of your head, from the top of your head?
Greatest challenges are, number 1, personal assistance services, home and community-based services to keep people out of institutions. Number 2, failures of monitoring and enforcing the laws that were designed to protect the rights of all of these people. Number 3, accessible, affordable housing that makes it possible for people to be able to protect themselves. And that accessible, affordable housing needs to be hardened so that people can stay safe in disasters. Number 4, we must engage the disability organizations as partners, the aging organizations as partners. FEMA had not had a meeting with national disability leaders since 2017. They had the first meeting with us last week to celebrate the Americans with Disabilities Act, but still couldn't tell us how FEMA is going to assist us in our call to get people relocated dangerous congregate facilities. So we were glad to finally be invited to the table, but we need, so number 5, and in some ways that's number 1, we need an immediate directive guidance to the states how they can take actions to relocate people to save their lives right now using the Category B emergency protective measures.
Thank you, Ms. Roth. The issue in the case of Puerto Rico, we're talking about all the natural disasters we just mentioned. But currently, FEMA got, with COVID, over 600 open disaster and prepared for potential disasters. In the case of the Eastern Coast, we're in the hurricane season as well. So that means that all the resources may be spread thin. And putting more requirements to FEMA also means that all those new regulations may imply more difficulties for the territories and states for apply for assistance. And we saw that during the last 2 years. And I need to say that in the case of Puerto Rico, FEMA has been doing an enormous and big change in how it works at the beginning. Now it's a direct communication with the municipalities, and a lot of those issues are being solved. Still, there are still a lot of challenges on the island regarding housing, the titles, and many others. So I know my time is near to expire, but I just need to say to Mr. Hindem, there are 3.2 million constituents in my district that are services by just one food bank, the Puerto Rico Food Bank. We managed to include some provisions during the supplemental, but we do not participate in SNAP. we participate in just NAP, which is the Program for Nutritional Assistance in the Territories. So how, and my last question, how organizations like yours can be boosted, can have more resources or provisions to enable more people to use it instead of having the government doing that?
You know, that's a great question, and I did hear back from the food bank in Puerto Rico, and just said FEMA's been doing a tremendous job supporting them through the hurricane and the earthquake. And you know, when we look at what the federal government could do with SNAP assistance, really, when you look at our service territory, it equates to about 12 times the amount of volume that the food bank does. And so it is a collaborative effort, and we're certainly here. And I think, you know, we all have a role, and we're all chipping in. We can't do it without tremendous partners. It does take a village in the sense that we're all, you know, all the pieces coming together to support the individuals dealing with food insecurity.
Thank you, Madam Chair.
May I ask one? May I add one?
My time expired, so Madam Chair will.
Go ahead, Ms. Roth, if
Thank you.
Briefly.
Thank you. I just want to give appreciation to the Congresswoman and the work that has been done in Puerto Rico, the Center for Independent Living, MOPS, and the University of Puerto Rico, University Affiliate Center there, done tremendous job and are a real example of good and promising practice for the rest of the country. And I just want to give a shout out to that partnership in private.
Thank you, Ms. Roth, and thank you, Madam Chair. Yield back.
Thank you. Are there any further questions from members of the committee? Mr. Katko?
No, but I do want to thank the chairwoman for this hearing. I want to thank the witnesses as well. I think it was a very good discussion, and a lot to chew on here and a lot to act on. So thank you very much for your appearance. I yield back.
Thank you, Mr. Katko. Just before we close, I want to be sure, is Mr. Garamendi with us? Does he have a question, or has he stepped away? Well, I guess he's stepped away or having technical difficulties, so we'll bring the hearing to a close. I, too, want to thank each of the witnesses today. Your contribution to our discussion was really informative and helpful, and we want to move some legislation out of this committee. Ms. Roth, I think you mentioned a couple of the bills, so we will stay in touch with you as we move forward and seek your wise counsel, because you're obviously the experts and the people we want to hear from as we do that. I ask unanimous consent that the record of today's hearing remain open until such time as our witnesses have provided answers to any questions that may have been submitted in writing or that we didn't have a chance to fully answer or explore. I also ask unanimous consent that the record remain open for 15 days for any additional comments and information submitted by members or witnesses to be included in the record of today's hearing. Without objection, so ordered. If no other members have anything to add, the subcommittee stands adjourned. Thank you.